70%. The European Union's hit the milestone of 70% of adults inoculated against COVID-19. It's quite a feat for a pandemic that's less than 2 years old and a vaccine that's only been available since January on this continent. Fury over the EU's misfires at the start of the campaign may already be fading from memory. However, COVID's not done with us. The vaccination rates vary wildly inside of the EU, and in many parts of the developing world, that inoculation rate remains below 2%. That's a failure we all share. And as the more contagious Delta variant runs rampant and new strains raise alarm bells, at what point does me first vaccine nationalism become, well, self-destructive? After all, it's the whole planet that has to be inoculated. What's the bar for the planet reaching herd immunity? On that score, after a great head start, why is the United States fallen behind Europe? And on the day pupils in this country start the new school year, where's the priority? Booster shots, jabs for teenagers, or, as we've been saying, shipping that vaccine abroad? Today in the France 24 debate, we're talking about the EU hitting that 70% vaccination milestone for adults. With us from Geneva, epidemiologist Unflow, director of the Global Health Institute at Geneva University. Thanks for joining us.
Good evening.
We welcome back Els Torile, global health researcher and advocate for access to medicines. Welcome back. And from Washington, Dr. Sarah Lynn Mark, former senior medical advisor at the U.S. Department of Health and Human Services. Welcome to the show.
Thank you very much.
The France 24 debate, where you can join the conversation, and you have on Facebook and Twitter, hashtag F24debate. It was in a tweet on Tuesday that European Commission President Ursula von der Leyen hailed the 70% threshold as a great achievement, all the while cautioning that the fight was far from over. Now, there's no argument there from the head of the World Health Organization in Berlin on Wednesday for the inauguration of a WHO hub for pandemic and epidemic intelligence. Tedros Adhanom pulling no punches, stating that nearly 3/4 of vaccines administered globally have been in just 10 countries. 75% of vaccines, 10 countries. Much of Africa remains below the 2% inoculation rate.
Some countries are now rolling out booster doses to fully vaccinated people when millions of people around the world have not even received their first dose. That's why I have called for a moratorium on boosters, at least until the end of this month.
A moratorium on boosters. Antoine Flau, do you agree?
Yes, I think it's very sensible to say that and to fix a limit. It's something which may be updated, but for the moment, there is not so many justification based on science that this third dose is useful for everybody. I'm not saying that the third dose should not be proposed to immunocompromised people who are very low segment of the population, and maybe to elderly, to very old people who may need a booster dose. But really, what is urgent, the priority now, is to vaccinate as much as possible the remaining part of the humanity who has not received yet these doses, the first 2 doses.
Because the way the announcement was made here in France on Wednesday was opening those appointments for all of the elderly. Your thoughts?
I think that it's a bit too large. I think it's not needed for the moment to give this third dose to the 60 or 65 plus people. Maybe they could benefit from an improved immunity or an improved antibodies levels, but we do not treat antibody levels. What we need to treat correctly and to prevent correctly is complication due to COVID and hospitalizations. And to date, to my knowledge, all the data coming from Israel itself, who recommends doses above 12 years old, but they demonstrated that the vaccine efficacy against the variant Delta regarding complication leading to hospitalization is very high. This vaccine efficacy is more than 85% in 50 plus, and below 50 years old, it is 92%. It is quite remarkable and quite excellent results of the vaccine efficacy against this variant Delta. So for the moment, there is not so many reasons to vaccinate even the elderly with this third dose.
Sarah Lynn Mark, it's been reported that with the Delta variant, those who've gotten the Pfizer-BioNTech jab are perhaps prone to getting COVID again.
Well, you're bringing up a very important topic, and that is we do not fully know the duration nor the durability of our immune response to vaccines, as well as to natural infection, including to variants. That's why the data is being gathered. That's why it's being assessed. When the White House made the announcement, it then went into a database collection for the FDA to review, and then it will go on to the CDC to make the final decisions. In regard to immunocompromised individuals, they have been approved to get their boosters. We have the data to show that a third shot does improve the level, not only of the antibody response, but also decreasing hospitalization for these individuals. I think what we have to realize is that it's not a one-size-fits-all approach, as my colleague just mentioned, that there needs to be a streamlining of who will qualify first for vaccines and to really understand when there is the timing for this vaccine. I think it is true that we all agree that we have to vaccinate the global population. If we have infection and outbreak in one part of the world, it impacts everybody. But I think we can do it together in the sense that you can still vaccinate your nation as well as provide vaccines for the global community.
Els Torila, you agree?
Well, we've been saying that for more than a year, and in principle, yes, it would be possible, but then we need to absolutely scale up vaccine manufacturing production everywhere in the globe, and in particular, ensure that also other countries than those that are currently producing vaccines or companies can actually produce the vaccines and decide where they go. Because what we see today is that despite all the promises that, yeah, we will first vaccinate the wealthy countries and then it will be a turn to the others, what we see now with the discussions about boosters, etc., that we are again not making progress of vaccinating the rest of the world. And I want to add here also that we need to think about this vaccination as this is about harm reduction. Where can you reduce the most harm in terms of people getting severely ill, people dying, people getting long COVID, etc. And I think a year ago already, or more than a year ago, it was very clear that in terms of reducing the most harm, the best way to do is rolling out vaccines equitably everywhere. And we are very far from that today. And now the risk with the discussions about a booster is that we are just going back and pushing all the countries where vaccination levels are very low back to the end of the queue. But the solution is more vaccines.
If I could just play devil's advocate here, it seems easier said than done. We remember a few months back, the French President Emmanuel Macron going to South Africa. They made a big announcement that there would be this push for vaccine production locally. What's become of that?
Well, apparently these things are not very much moving forward because one of the major challenges is that the companies that are mastering the technology have so far refused to share that technology with companies that are willing to make the vaccines. What we see sometimes is what we call fill and finish, just the very last part of putting the vaccines that have been produced elsewhere in vials. That sometimes is being located in developing countries. But the real technology transfer, that we are still waiting, and Macron and others have made a lot of announcements, but that is still being blocked. And as you know, there was a proposal already a year ago by South Africa and India to actually get a waiver on the intellectual property that would facilitate the sharing of that technology, and that also has still been blocked, mainly by wealthy countries, including Europe, unfortunately.
Unflow, you're sitting in Geneva, a major pharmaceutical producer. What do people think about this concept of lifting the intellectual property rights for this global emergency?
You know, as it has been just said, there is a lot of talks, even from prominent leaders, Western leaders, to say that we should lift the intellectual property. But at the World Trade Organization, all the discussions have been suspended at the beginning of July, and nobody was very keen to accelerate the process when it is an emergency. You know, we cannot wait for years to vaccinate the whole world. We absolutely need.
And why is this? Why are they dragging their feet? Is it just a question of profit, of making money for these pharmaceutical labs?
Yes, this is absolutely around money, because this would create something which really the pharmaceutical companies do not want to engage in, because after that will be around the essential drugs and maybe other drugs who are needed in poor countries, and mostly the pharmaceutical companies, and in a way the countries which host them do not want that. What is also to be said is that it's not only a question of intellectual property. It has been clearly said just before me that it's also a question of technology transfer. And if you want a technology transfer, you need, for instance, in the case of mRNA vaccines, you need the participation, the active collaboration of the pharmaceutical industry who has the know-how. And if you do not have this good willingness from these pharmaceutical groups to participate in transferring the technologies, only the waiving of the intellectual property will not be enough. So it's complex issues, but I think and I hope that the pandemic treaty at the WHO next year will try to address these issues together with the World Trade Organization.
Sarah Lynn Mark, these pharmaceutical companies in the last quarter announced, and they've become household names because we all know which vaccine comes from where now. They announced ginormous profits. How's that playing where you are?
Well, you know, it's always a question of whether an agent is developed because of profit or because it serves value to society. And I think generally people accept that there is a significant value to society. Capitalism doesn't have to be contrary to doing good for humanity. I think, as again my colleague mentioned, the issues are quite complex. There does need to be standardization of the vaccine process. When you look at the life cycle of a vaccine, of course, there was the development phase, there's the manufacturing, and there's the distribution. And we really have to assess each of those levels and to ensure that there is standardization so that what is produced is safe and effective for the populations that receive these vaccines.
And so far, that's proved to be the case, has it not?
As in the United States.
Yeah, because Sarah, let me ask you at this point. NBC News reporting on Wednesday that pharmacies and state governments in the U.S. had thrown away more than 15 million doses of COVID-19 vaccine since March, and that is probably an undercount, says NBC. Just can you give our viewers a sense? Is that normal when you're trying to vaccinate with 2 doses in most cases, more than 300 million people?
Yes, it's over 400 million doses have been distributed. We have shots into arms of over 50% of the population in America is fully vaccinated. 80% have received at least 1 shot or 1 jab. So it's been a Herculean effort. You don't want to waste any vaccine, but we do know it does happen, and there are many reasons for it. One, these vaccines have to be given in a certain window of time so that if you administer 1 shot, then you have a certain window of time where you have to use that whole vial. It has been felt that if you can get at least 1 individual vaccinated who comes in, you take advantage of that opportunity. So there may need to be a look at how do we do different processing of these vials? How do we make it so it's more efficient? We also have
is 15 million too much waste?
So that it has to be kept at a particular temperature. You know, any shot that is not used is a waste. Now, the question is, what do you learn from it? I think we have to keep in mind that we're still in an early phase of a pandemic. There are going to be challenges that are encountered. There are mistakes that are made. It doesn't mean that you continue them and you repeat them. You learn from them. So I am optimistic going forward that there'll be a more efficient system. The key thing here is that we need to get shots into arms. We need to decrease vaccine hesitancy, and we need to get the population to understand the value of a vaccine.
And Dr. Mark, on both sides of the Atlantic, there's vaccine hesitancy, as you put it. Yet why is it that the EU's reached 70% and the US is still just slightly over 50%?
Well, it's 50% fully vaccinated. I could speak for the U.S. There are many reasons why there has been hesitancy and challenges. Initially, it was due to access. I think we've certainly improved upon that. There's also a lot of misinformation. I think through social media, information is conveyed and it's deemed truth when it may not be. There's often fear of something new. I think as we move forward, we now have a larger database and people can feel more comfortable, more assured. And then also recently, we have had approval, not just emergency use authorization, but actual approval. And hopefully that will decrease hesitancy as well.
But we've had the same misinformation here.
Well, I think politics plays, sadly, an important role, and it has polarized the population. Unfortunately, that is often hard. It's tenacious to get out of a system. So I think over time, when you have key opinion leaders, you have public health officials within the community, you have community leaders, and family members who can share information and allow people to feel more comfortable taking a vaccine. I think as we've seen the ravages of the Delta variant across especially the South and the high hospitalization rates and death rates, and then it was just mentioned long COVID, hopefully this will encourage people to realize the value of a vaccine and how they can protect themselves and their family members.
All right, we're going to talk more about it when we come back. Stay with us. You're watching the France 24 debate. Welcome back, or welcome if you're just joining us. It's the France 24 debate, and we are talking about the EU reaching that 70% of fully vaccinated adults threshold. Mind you, it varies wildly. Countries like Romania, which is at a little over 32%, Bulgaria somewhere north of 20% vaccinated. So there are discrepancies even inside the EU. We've been talking about it with, from Geneva, epidemiologist Unflow, director of the Global Health Institute at the University of Geneva. Also in Geneva is Els Terreel, global health researcher and advocate for access to medicines. And from Washington, Dr. Sarah Lynn Mark, former senior medical advisor at the U.S. Department of Health and Human Services. On the hashtag F24debate, David from Jerusalem writes the following: the answer to scarcity is not rationing, it's manufacturing. There's no world government, no national government is going to let, and no national government is going to let its own people die to help other countries. If we need more doses, make more doses. So if you need more doses, make more doses. Els Terreel, your reaction?
Yeah, absolutely. That is what many of us have been asking and saying and pleading for since the beginning of the vaccines that we had the evidence that they worked. The reason why we don't have enough vaccines is because we have monopolies held by companies, and they decide how many vaccines they make and to whom they will sell them. And what we have seen is, despite and against the recommendation of the World Health Organization, that it would be best if we would vaccinate the whole world gradually, starting with the most vulnerable and the healthcare workers, and then gradually vaccinate more and more. What we've seen is that countries have started to vaccinate their own population first, vaccine nationalism, hoarding, etc. But that is because the companies have the monopolies and decide to whom to sell. And of course, those that offer the most money will be the first served. And there have been all kinds of deals that, by the way, have remained secret, advanced purchase commitments that wealthy countries, Europe, US, UK, have concluded with the vaccine manufacturers even before we knew that the vaccines were effective. And so they've actually crowded out the little vaccines that were available. And this is happening again and again and again. I don't know whether you've realized that you mentioned that there is 70% vaccination coverage in Europe. Fantastic. But that just recently, it turned out that Johnson & Johnson, who had started to produce only the packaging part in South Africa, where we have an enormous vaccine scarcity and inequity, that vaccines produced in South Africa were being shipped to Europe, where we have already a high vaccination rate, because they can decide to whom they sell it. And that is why we need more production, but more production by more producers in different countries, such that we can actually have a distribution that is fair and equitable.
And who's been better, with hindsight, in dealing with this vaccine rollout? Is it the EU? Is it the UK? Is it the US?
With the rollout?
Yes.
I don't have a particular opinion on the rollout. What in the countries themselves, what I think they have all done wrong is actually choose to vaccinate first their own population, and through that actually depriving the most vulnerable in other countries to actually be protected as well. I think that is the biggest problem about the rollout, but it's a global and it's a political problem.
Els, we're heading into an election year in France. There's an election at the end of this month in Germany. How would it go down if a sitting leader said, well, we're going to send vaccine abroad first?
But the point is, it's not about sending vaccines abroad. It's about allowing, ensuring, facilitating that more vaccines can be produced. We should have started that a year ago. Then we would have many more vaccines, as the person also wrote. And today we don't have that. Of course, now there is a question, if there are leftover vaccines, why don't we indeed ship them to the rest of the world? But that is charity. What we need is justice and equity, and for that we need to also do more production. And it's not about saying, well, Western leaders who say, well, we'll ship the vaccines to the third world and not vaccinate here. As we already said, there is an enormous vaccination, a high vaccination uptake, and that's fantastic. So there is a high degree of protection, and I recommend everybody else that is not vaccinated to be vaccinated. But we need to allow more production. That is the real key.
Is there a problem to Unflow with allowing or not more production?
Yes, we can acknowledge the fact that we have succeeded to distribute 5+ billion doses in less than 8 months. So in a way, it is very promising. And we can imagine that in the next, I will say, 12 months, without a major breakthrough in producing the vaccines, we should be able to distribute again 10 billion doses to the world. The point is, to who would we like to distribute these doses? If we take a third dose, and most probably there will be advocates for saying we need the fourth dose in 3 months or in 4 months, then we will not distribute these doses again to those who need at least 1 and 2 doses. It's not just a question of fairness and equity and ethics. Of course it is, but it is, I think, a question of global health security. I mean, it's probably very short-term sight to believe that we should take all the third and fourth dose to ourselves in Europe, in the USA, in the very wealthy countries, and to know they will have the 1 or 2 doses when we will have some remaining doses. It's short-sighted because of our own security. So my thinking is just not because of an ethic and equity problem, but for our own security, we should immediately and prioritize the first 2 doses to the total humanity now.
Yeah, and I guess to highlight the contrast between those countries where it's less than 2% vaccinated and the developed world, if you call it like that. On Wednesday, Denmark, with its vaccination rate approaching 75%, it lifted vaccine passports. You don't need a mask, and you don't need to show a vaccine passport in public places there. Your thoughts on that, Unflow?
My first thought is it's a bit of pity that there is not a better harmonization among the European Union countries to know when to do that and when to restrict more. My feeling is that it is the worst period to do such lifting the measures now, because now people are coming back from their vacation, they are importing to Denmark some strains, maybe some new variants, maybe some variants Delta, and the interactions will be, of course, higher. The public transportation will be more crowded. The schools will not remain open, will not remain closed because of the vacation, and so on. So I do not think it is the right time to do that, but at least a kind of harmonizations between the European countries would be very welcome to discuss that. I'm not so sure that the Denmark is in so well epidemiological situations to just lift all the measures. What we have to know and to acknowledge is that Denmark is rather performant against this pandemic from the beginning of the pandemic. In terms of mortality, the figures from Denmark are much better than those from France or from the UK or even from Switzerland, where I am today. So in a way, I don't have lessons to give to Denmark. If they think it is appropriate, we will see that, and we will. It's for us, of course, a very good experience. In the same way, if I can come back to the Israeli experience, I am not unhappy to see that they move towards the third dose. It's a small country, 8.5 million people. It will be a very good experience for all of us to know if that was so useful or not. So in a way, to have some countries taking some bet and trying to explore some innovative way to deal with this pandemic is not so bad.
It'll teach us lessons. You mentioned schools opening up. It's the start of the new school year on this side of the Swiss border. 12 million French boys and girls. By now they know the drill. It's their second time back to school under COVID. Ellen Gainsford has more.
Pupils are greeted at the door with a squirt of hand sanitizer. It's the new normal as French children head back to school. In Marseille, one class had a presidential welcome back.
Et qu'est-ce que tu veux faire?
Président.
Il peut y arriver, il peut y arriver.
Non mais vas-y.
Ce président soit concessionnaire ou d'une nouvelle marque.
Ah, alors ça n'a pas grand-chose à voir, mais tu sais. T'aimes bien les voitures?
Ouais.
But some doctors are concerned. The infection rate among children is higher than this time last year, and around 37% of teenagers in France aren't vaccinated yet.
L'épidémie va reprendre en France parce que les gens vont se croiser davantage et qu'il reste 9 400 000 enfants de moins de 12 ans qui ne sont pas du tout vaccinés et 9 300 000 personnes de 12 ans et plus qui ne sont pas vaccinées.
All children over the age of 6 have to wear masks inside. If a high school or college student comes into contact with a COVID case, members of their class who are vaccinated won't have to isolate. But for younger students, the entire class will have to take time off school. Teachers are doing their best to avoid infections.
Alors masque à disposition des élèves, masque à disposition des visiteurs, gel hydroalcoolique dans toutes les salles de classe, dans tous les espaces communs, purificateur d'air, capteur de CO2 dans les salles, protocole, plexiglas à la cantine, limitation des brassages entre les niveaux.
To help keep the spread of the virus down, the Education Minister has announced plans for at least 600,000 saliva tests a week in schools across France.
So far in this discussion, Sarah-Lynn, Mark, you've heard your fellow panelists say that what's in everyone's self-interest is to get essential workers around the globe and then the most vulnerable around the globe vaccinated. So what do? It's the start of a new school year in Europe, in the United States. Do you vaccinate kids?
You know, it's such a critical time. In the U.S., we're getting our students back to school, and yet we saw over 500 million students, 500,000 students were infected with COVID last month, 500,000, and the numbers are growing. I think you brought up a very important point here, and that is also about masking. And that has certainly created a great deal of debate in the United States and certainly abroad. And I do see them in tandem, vaccination and masking. In regard to children in the U.S., we are looking at under the age of 12, data is being gathered again to see how do you administer it, what's the most effective way. So it really behooves adults who can protect children to do what they can, such as through masking, social distancing, and vaccination. It's a worrisome time, as mentioned in your clip, that if a student tests positive, then often the whole class or the whole school has to quarantine. So I think we have to be on guard. It's a very tenuous time. I know that as case rates go down, we often lift our restrictions, but I think at this point we have to be very, very much on guard. We have a lot at stake, getting our kids back to school, people coming back from vacations, and we need to get these case rates down. Again, as a virus is able to replicate, it can mutate. Right now in the US, we're focused on the Delta variant, but there can be others on the horizon, so we have to be on guard.
Yeah, the Delta variant, certainly not the last. The United Nations keeping a close eye on what's been dubbed, I hope I'm pronouncing this correctly, the Mu variant, or the Mu variant. It says that it's becoming increasingly prevalent in Colombia and Ecuador, showing signs of possible resistance to vaccine. Sarah-Lynn, Mark, is that next, the Mu variant?
Well, I think there are many variants across the globe. It's just a question whether it can get into a population and replicate, and that's why it is so important that if you vaccinate, or if you have it available to do it, but also masking. I really want us to increase our attention on masking. It can help to prevent spread. Unfortunately, I think it's been associated with punishment, and it's been said that if you vaccinate, you might be able to get rid of your mask. I didn't quite understand why that was hand in glove. I think they both are very, very important to win this battle.
Yeah, they even, the day there was this day when everyone at the White House took their mask off?
Well, I think, again, it's a form of freedom where you don't feel confined, but yet I think masking is just another medical device. It's unfortunate that we have politicized it, that we have made it a form of punishment. It's really a very, very important medical device for all of us to wear. And on that, I would love to see even better designs for our face masks. We know for women, for example, they may not fit as effectively. So I think putting out a global challenge here is to develop better masks so people feel more comfortable, have them fit better, and have them be more effective.
Els Taril, when COVID hit in the spring of 2020, we, and I personally included, didn't realize to what point science can be political. And you're hearing it now in what Sarah-Lynn, Mark has just been saying. At this point in time, is the divide, the polarization worse, better? We've seen anti-vaxxers demonstrating here in France this summer. Is the polarization over the science getting any better?
My sense is that there is less polarization, despite there being many, but I think the fact that we have vaccines that are clearly effective, we have a few medicines that have shown to work, we have diagnostics, we have all the knowledge that we've assembled around the virus, its spread, the genetics, etc., the masks. I think we have a lot of knowledge, and I think there is more acceptance that all this knowledge is important. So I don't think so much polarization, but there are a couple of issues, and I'm happy that my colleague brought up the mask, because it's true that there is this idea that once you're vaccinated, that you can no longer transmit the virus. And this is a very big mistake, because we can still, maybe to a lesser extent, we don't exactly know it, and it may be different for different variants, but it's not because we're vaccinated that we cannot transmit the virus anymore. And this is where the idea that is still in many people's minds and words, I think you mentioned it in your introduction, the idea that we're trying to obtain herd immunity is actually not the right way of looking at it, because with the vaccines that we have today, and given that we are only vaccinating a number of countries and leaving large parts of the population without vaccine, it's impossible to achieve herd immunity. And the idea about herd immunity is also you get so many people vaccinated that those little percentage that are not vaccinated will be protected, because there is no more virus circulating. But as we said, with the current vaccines, the virus continues to circulate. So we should keep our masks and all our other distancing behaviors to actually tackle the virus, not with one arm, but with all the tools we have. That is the only way in which we will actually curb the pandemic and potentially come to a situation where we can live with it. But that requires that there is, again, a global distribution and availability of vaccines everywhere, such that we can actually lower the virus, but we will have to keep protecting ourselves also with masks.
Dr. Unflow, don't bank on herd immunity. You agree?
Yes, I fully agree with what have been said. So we have to combine the measures, and this is the only way to succeed against the pandemic. It was very interesting to see in Israel that even with 70% of vaccinated people, they are facing just now a strong wave, the strongest wave they had never experienced before. And it's not because of a lack of efficacy of the vaccines, as we said earlier. So it is still possible to transmit the virus even when you are vaccinated. So, of course, with a strong reduction. So combining the various methods, we said masks, we have also to say ventilation of closed and crowded location, but also repeating tests. I think the test should be better coordinated. I mean, not only the PCR test, but also saliva test, maybe PCR on saliva, should be better organized, more massively conducted in schools, for instance, but maybe also in some companies for the workers, and should be pooled to be parsimonious, to save costs, and should allow for detecting the so many asymptomatic people who are carrying the virus and transmitting the virus, and who can be only detected through systematic tests. So testing, masking, ventilation, and vaccines are the four pillars against this pandemic, probably also with the border controls.
All right, much more work ahead. Many thanks, Unflow, for joining us from Geneva. Els Turil, also in the Swiss city, and Sarah Lynn Mark in Washington. Thank you for joining us here in the France 24 debate.